Dr. Magnifico from GeriatricVetPobly.com. This is Blitz. He is a 4-year-old pit bull who was just adopted by a new family, and they realized that he's got a broken canine tooth. So the canine tooth is that upper incisor, that upper cuspid in your mouth, the big tooth on the side of your mouth. We are going to try to get a quick picture of that if he's going to let us. So it's on that side, and you can see that that upper tooth is fractured. There we go, good. He has got the pulp exposed. So when you get the pulp exposed, it means that that nerve root is exposed, which means that it can be painful. So his options for now are we monitor the tooth to see if it changes color. When it changes color, it means that the tooth is dying. He can go to an orthodontic surgeon and they can do a root canal. So some of those dogs, you'll see a dog with a silver or a gold tooth. That means that that tooth has been sort of killed by the root canal and then filled, so it maintains its structural integrity. Or we pull the tooth. That canine tooth is really long, so it has a root about that long, so almost 2 inches long in some cases. So it's very difficult to get out of the face, which is why it gets expensive. It can be difficult and take a long time to get out, so that's why sometimes it gets expensive. To get a root canal, you have to have that root canal done within the first couple of days to weeks that that tooth has been jeopardized. So we can send him to an orthodontic surgeon. It's probably going to be about $1,500 to $2,000. They don't always take, meaning sometimes that tooth loses viability anyway. So cost usually ends up being the biggest concern that these guys don't get a root canal. But it does provide the best maintenance of function, and they're chewing and they maintain that tooth. Lots of people just choose to kind of wait and see how the tooth does. There are a lot of dogs walking around with broken teeth. If it continues to cause him pain and trouble eating, then the best scenario is to either take it out, so he doesn't have that open channel between the mouth, which is full of bacteria, and your sinus cavities, which live above your tooth, or to get an orthodontist to cap it. A root canal really is typically only done by a boarded dentist, so it's not done typically in most of the general practitioner's office. Typically we send you for that because it is such a detailed, specialty practice. So we're going to talk to Blitz and his family about sending you to an orthodontist, about having that tooth taken out, or about what to monitor. But if you notice that your dog's having trouble chewing and you notice that the tooth is broken, it's really important to have the tooth integrity checked to see if the pulp is exposed. That's it. Take care.